Okay, thank you for joining us this evening. This evening, we're going to have a presentation about our certificate in global tobacco control. Your presenters will be Joanna Cohen, Director of the Institute for Global Tobacco Control, and myself. My name is Angelica Santiago. I'm an admissions officer for the online program. Okay, so here you'll see, my name is Angelica Santiago. I'm an admissions officer for the online programs. I work specifically with our online programs at Applied Learning. I've been in admissions and in online graduate admissions the past 5.5 years, and working specifically with Johns Hopkins and the Bloomberg School of Public Health the past 3 years. Joanna, can you please take a moment and introduce yourself to our audience tonight?
Sure. Hi, my name is Joanna. I'm Director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. I'm also the Bloomberg Professor of Disease Prevention within the Department of Health, Behavior, and Society. And I've been doing tobacco policy research for 25 years. So I'm really excited to talk to you about the program that we have to offer.
Great, thank you for that introduction. So just to give everyone an idea of what we're going to be going over tonight, Joanna's going to start us off with being able to talk about tobacco control and a brief introduction of the program and a little bit into the industry. So tobacco use is the #1 preventable cause of death in the world. So through this conversation this evening, you're going to be able to hear a little bit more about the career opportunities through this program. She'll go over program details, so you do understand how long the program is, a little bit of what you're going to be experiencing as far as how the coursework is delivered. Joanna's also going to be able to go over the curriculum. There's 8 courses in the program. You'll get an understanding of the technical skills gained through the program to support effective tobacco control policy development and implementation. She'll also go on to talk about the online experience. For those who have not had any online experience before, she'll discuss what it looks like to be in the online program, a little bit about the background of Johns Hopkins, Bloomberg School of Public Health, and the experience that we have with online learning, and the faculty that will be teaching this program. So who leads this program? You see Joanna has a very vast experience in this area, and you'll hear a little bit more about the other faculty members that are involved. I'll go on to talk about the application process and talk about the scholarships for the program as well as financial aid, a little information about the admissions requirements. And as you are listening to the presentation, please feel free to take a moment to type in any questions that you may have in the chat box, and we will make sure to go over them at the end of the presentation. We're setting aside time for Q&A specifically just to get to your personal questions. So thank you for your time tonight, and Joanna?
Great. So as Angelica said, I wanted to start with a brief overview of tobacco control and careers in this field before we go on to the specifics of the certificate program. So we're starting with a quote from the current Commissioner of the United States Food and Drug Administration. And he's not the first one to say this, but he said it as well. And this quote sort of sums up the reason why people in health are very interested in focusing on tobacco control. So he says that cigarettes are the only legal consumer product that, when used as intended, will kill half of all long-term users. So this is a highly deadly product. Unfortunately, because of its history, it's still legal and being used extensively. As Angelica said, these tobacco products and their use result in much death and disease, and in fact represents the primary cause of preventable death in the world. And the tragedy here is that each one of these deaths is completely preventable. There's no reason one person has to get sick or die from tobacco products. We do not need these products to survive. And the outlook is pretty grim. The World Health Organization has projected that 1 billion people will die from tobacco product use in the 21st century. And one of the reasons for the epidemic proportions of death and disease is the vector of disease, in this case, the tobacco industry, that targets youth with their products, interferes with government efforts to enact and implement effective tobacco control policies, and come out with new products to obfuscate the debate and try to take attention away from their own deadly products. On the positive side, though, we have the World Health Organization's Framework Convention on Tobacco Control. It is an international public health treaty that has been ratified by over 180 countries. And it lays out both demand and supply-related interventions that are known to be effective at reducing death and disease from tobacco use. At the same time, tobacco regulatory science, particularly in the United States with the Food and Drug Administration, been given the mandate to regulate tobacco products. So there's a lot of interest in tobacco regulatory science, and that also is sort of an area ripe for knowledge, research, and translation. So this results in a lot of career options for people with training in tobacco control. Because of the immense burden of that these products cause, there's a lot of work to be done. And so it's important that we train the next generation of tobacco control leaders to work in this field, not just right now, but in the future as well. And there are a lot of skills that are important to be successful in this area, and they include being able to undertake both qualitative and quantitative analyses, to do strategic communications, to play leadership roles, and to understand the factors that can facilitate the proper implementation of tobacco control policies. So there are a wide range of public health and medical professionals, and those in other fields as well, that are well placed to contribute to addressing the tobacco epidemic. And there are many organizations that need people with this training. So at one level, you have city governments, state governments, national governments, and their regulatory agencies that all have people trained in tobacco control and doing that work. There are also a lot of jobs in the civil society sector and non-governmental organizations and universities as well. And that's where I sit, and I know I've always look to hire people with training and experience in this area. So we have on the slide a list of possible job titles that people might be qualified for after completing the certificate program, from directors of research through to research associates and research managers and project managers and various scientists and analysts. So there are a lot of positions that people with the training from our certificate program would be eligible to apply for. So let me tell you about the program itself. It's a 1-year certificate program, and participants do it part-time. All of the courses are offered online. So this is an online program, and there are a total of 25 credits that people would take. At the Bloomberg School of Public Health, we structure our educational programs into 4 quarters or terms, and they're each 8 weeks long. So there are 4 terms of 8 weeks, and in those terms, you would be taking pretty much 2 courses each. So there are the online courses, and they include training that is important for professional development, and I'll go through these specific courses shortly. There is group learning that occurs, as well as peer assessment, and it's very skills oriented. We're interested in giving you the knowledge to work in this field, but even more importantly, the skills to be able to make a difference. So there will be projects and hands-on learning in the program. The goal of the program is to provide formal education, and that's broadly defined, both in terms of knowledge and practice, to research scientists and public health professionals, to equip them with the technical skills that are necessary to develop and effectively communicate the evidence that's required to support effective tobacco control policy development and implementation. So this is the curriculum in a snapshot. Each of the courses are laid out by terms. So there is a prerequisite, and that is a course on online learning, just so you can learn how to use our online learning system. It's not very difficult, but we want to make sure you hit the ground running when the courses begin. So it's important to take that introductory course. And then you start the first term. There's an academic and research ethics course that you are also required to take. All graduate students at the Bloomberg School are required to take this course as part of the accreditation. And in the first term, you'll also be taking a course called Global Tobacco Control to get a broad perspective on the history as well as the future of tobacco control. And you'll take a strategic communications planning course, learning how to communicate strategically, predominantly through programs, mass media, etc. Very important for tobacco control. In the second term, you'll take a course on tobacco regulatory science to understand what that means and all the components of regulatory science, what we know, all the things we don't know yet, what the latest trends are in this new field. And you'll also take a course on tobacco control leadership. So we do expect and give you the skills to be a leader no matter where you sit in your organization. So this is a course that we feel is essential as an essential component of the certificate program. In the third term, you'll take a course called Quantitative Methods for Tobacco Control. So that will give you the basic methods that are quantitative, that can help you do planning and evaluation. So you'll cover sort of those quantitative skills that are important. And we also have in the third term a course on, or it's a workshop for writing for results to really help with your written skills, because written communication is so important in the policy world as a way to present briefs and other information to policymakers. And then in the fourth and last term, there are again 2 courses that you would take. One is on qualitative methods for tobacco control. So that would cover things like observations and document review, focus group discussions, key informant interviews. These are also really important skills for doing work in tobacco control. And the final course that is part of the program is called Implementation of Tobacco Control Policies and Programs. So we teach you about all the work that needs to be done to get policies enacted and passed. But the hard work does not stop there. Actually, it's only just beginning, because there's a huge fight that continues in the implementation phase. So we'll go over frameworks that can help us understand and predict some of the issues that will arise during the implementation phase, so that we can hopefully avoid them. So that's a summary of the curriculum and the specific courses that are part of the certificate program. Okay, so as we said, this is an online program. So I'm at the Institute for Global Tobacco Control, which has been around since 1998. And our mission is to prevent death and disease from tobacco products by generating evidence to support effective tobacco control interventions. And we also do that through capacity building, including this certificate program, as well as other courses and workshops. The program that we're talking about is being taught by experts in the field that both have a very solid grounding in the theory, but also are very practice oriented. So they've all worked with various sectors to plan projects, to evaluate policies, etc. Of course, the courses are designed to keep you engaged and to allow you to practice the skills that are going to be necessary once you've completed the program. The online learning allows you to participate or to learn the material at a time that is convenient for you. Although you have to keep in mind these are 8-week terms, so things move pretty quickly. But it's not like you have to be in a particular chair at on a certain day and time. The only exception are a few live talks that occur during some of the courses that allows you to interact in real time with the instructors. And we do have a 24/7 help desk that's available to you if you run into any problems. All right, so here's a list of the faculty that are involved in teaching the courses. So I am the program director for the certificate program, and we have other faculty at Hopkins. So Dr. Ryan Kennedy, Dr. Lisa Lagasse, Dr. Fran Stillman, Dr. Steve Tamplin, and Dr. Kevin Welding all teach courses in this program. And again, we're thrilled at the Institute for Global Tobacco Control to be able to offer the certificate program to you. We collaborate with a number of organizations, including the World Health Organization. We're a collaborating center of the WHO. We work within the Bloomberg Initiative to Reduce Tobacco Use, which is funded by Bloomberg Philanthropies. We've done work with the Robert Wood Johnson Foundation, with the Monday Campaigns, which is a nonprofit organization, and with research funding agencies as well, including the National Institutes of Health.
Perfect. Well, thank you for that overview of the program and all the details on that information, Joanna. At this time, I want to take some time and go over a little bit about the admissions requirements and the application process for the certificate. So applications for this program are processed through Sophus Express, which is a third-party application portal. The expectations for students who are applying to the certificate is that you do hold a bachelor's degree from an accredited college or university. You have to upload and share a copy of your current resume or CV. Obtain 3 letters of recommendation. Now, this will look different for everybody. This could be a combination of academic or professional references, depending on where you're at in your career and kind of what is the best, who can speak to your background the best. Also, demonstrated interest or involvement in the field of tobacco control. So be able to speak through in a statement of purpose, why? Why are you looking at this program? How will this help you in your goals? What skills and knowledge you are looking to gain and how you hope to use it in the future as far as tobacco control is concerned. For our international students, it is a requirement that you demonstrate a proficiency in English, as well as obtain your academic records and have them gone through a course-by-course credential evaluation via the World Education Services. Any specific questions that come up around these parts of the admissions requirements or the application process, we do have application specialists in the office and admissions officers like myself that are here to answer these type of questions. So if you don't want to put your information specifically into the chat box, if it's personal, you can always feel free. My contact information will be on the last slide, and we'll be happy to kind of speak one-on-one with you about your background and any information that you might need to know to move forward in an application. Now, to go over some of the financial aid and tuition information, we'll start with what is the current tuition rate for the university. So for the 2018-2019 school year, the per credit cost is $1,128 per credit. Scholarships, however, are available. So we have 2 different scholarships. We have our partial scholarship, which is listed first, the Opal Scholarship. This scholarship covers about $433 on every credit, and that leaves students responsible for the remaining $695 per credit for the courses. So basically, the Opal Scholarship will cover 1/3 of the cost of the program. Second scholarship we have is the IGTC Scholarship. This is the full tuition scholarship. It is specific to applicants from certain regions. That would be the low and middle income countries. Students from any who are working and living in any low or middle income country can apply for the full tuition coverage. The admissions application also serves as the scholarship application. So just knowing what I went over in the previous slide as far as the requirements for applying, that would be the only thing you have to do. You do not have to do any separate paperwork or to request any of the scholarships. We also have a financial aid office. So if you need more information as far as federal loans or private loan processing, you'll be able to obtain some additional information there. And of course, our tuition rates and scholarships, as I mentioned, that is for the 2018-19 school year. However, any changes that are made to scholarships or tuition rates are assessed in the late spring of each year. Now, the great thing about the application process is that even though the full application is open until July 1st, we review applicants on a monthly basis. So as applications come in and they are sent forward to our admissions committee for review, so you can receive a decision in a timely manner and really start planning for next year, what it'll look like in the fall to be in school. The application deadlines, however, do vary based on the scholarship eligibility. So for those students who are eligible for the IGTC scholarship, again, those are the students that are living and working in low and middle income countries. You need to submit your application components except for the WES evaluation by July 31st of this coming year. So that means you would have to complete the application as far as your letters of reference. You would only have to upload your transcripts or academic records, whatever copies you have. Any official evaluations would be done after you receive your decision for the scholarship. All other applicants for the program do have to submit applications by July 1st to be considered for the fall. And for this program, students are enrolled one time per year. Our next starting date will be Tuesday, September 3rd of 2019. I know that's a lot of information to share as far as the scholarships and the different scholarships awarded and offered. So if you have specific questions, please let us know. Either type them into the chat box or feel free to email me directly so we can make sure to answer your questions in full and make sure you have the information needed. So at this time, we're going to open up for a Q&A session, making sure that we answer any questions you may have after this session. So we're going to start off. I saw we have a couple of questions that already came in. Joanna, I think there's a question that you can take first just because you touched on this already when you were talking about the careers. So I know the person said that you mentioned some of the different jobs that can be had with education that focuses in this area, but they want to know examples of what kinds of organizations they can find employment in.
Great, yeah, I'd be happy to answer that. So there are all kinds of organizations that do tobacco control work and that would need people with this training. So one would be, one class of organizations would be non-governmental organizations or civil society organizations or the nonprofit sector. Those are all sort of good enough synonyms for us. So they might do some research and advocacy work or communications. Those types of organizations could think of something like the American Lung Association or a big one in Washington, D.C. that does both domestic and global work and focuses on tobacco is the Campaign for Tobacco-Free Kids. These are all just examples of the types of the organizations that are non-governmental organizations that would need people with training in this area. Another sort of class of organizations are government departments. So like the health department, because tobacco is such a prevalent form or prevalent cause of death and disease, many governments are trying to address this problem. So that could be at the national level, and the Department of Health at the national level. It could be at a state level. It could be at a city level or a county health department level. So, and then it could be in other countries as well. So that's another government agencies are another class of organizations, and that would also include regulatory agencies, such as in the United States, the Food and Drug Administration. They're in great need. They've been ramping up with their staff, and they are still hiring. And then there's a third class of organizations, which are universities themselves. So there is fortunately a good amount of research funding in the area of tobacco, and that means that faculty members need to hire other faculty members and also sort of research associates or program managers, those types of positions to help with the research projects that they're doing. So those are just some examples of the types of organizations that would be looking for people with this type of training.
Perfect. Thank you. Thank you. There was another question that was more geared towards the class work, which again, I think would be helpful for you to answer. I do have some insight based on some of the students that I have talked to. But in your opinion, given the rigor of the coursework, how much time will they have to devote to the program on a weekly basis?
Right. So our program is accredited, and that means that for each credit hour of sort of lecture time or contact time, you are expected to do about 2 hours of work on your own. So that would include doing the readings for the week or working on your assignments or anything else that is assigned. So for a 3-credit course, that would be around 6 hours of time beyond the lectures and live talks that you would be required to that is sort of build the course to sort of require around that amount of time.
Perfect. I think that is I can just echo that. That's from the students that I've spoken to. That is about the amount of time that they've displayed, anywhere between 18 maybe 20 hours a week, given the 6 credits a term. In your experience with online coursework, they also want to know, is there a lot of tests? So we talked about a lot of application and technical skills. Is there a lot of testing involved in the coursework?
I wouldn't call it testing. I think we try to, there is assessment because you are getting, this is a degree program and you are getting credits and a certificate at the end. So, so there are assessments rather than testing. And I think for almost, if not all the required courses, the assessments are very practice-based and give you an opportunity to practice the skills that are being taught. So there are definitely assessments. There are no exams or tests per se, but there are assignments and assessments.
Perfect. Another question that came up this evening, and thank you for the person who submitted this question, because this also comes up a lot in the conversations that I have with students, is the expectation around students in terms of their quantitative or math background. Does that mean statistics? Does that mean calculus, algebra? What's the expectation from students who are applying?
Yeah, well, we do like to see applicants with some statistics in their background, but if it's some other quantitative course, it's just helpful in terms of being able to do well in our sort of quantitative methods for tobacco control course. So we do look for some evidence of quantitative background, but again, in the end, it'll be a combination of things. If you are a really strong applicant but are missing, don't necessarily have that piece, we would sort of take the other components of your application into account. So, if you had lots of experience in this area, for example, but it is helpful to have a bit of quantitative background.
Perfect, thank you. I have a question that I feel like I can probably elaborate on, and if you have any additional insight, please feel free to share. this student was asking a little bit more about the eligibility for the IGTC full scholarship. So just to run down a list of students who would be eligible for that, you have to be from or working in a low and middle income country as defined by the World Bank. If you have any questions or concerns with deciding if the country where you live and work is eligible, you can always feel free to reach out to us directly. Students must fluently speak and read and understand English, and that is for the purposes of being able to actively participate in a fast-paced, English academic program, English-based academic program. So, to my knowledge, and you can confirm for me, Joanna, students are not required to take the TOEFL or IELTS as long as they can demonstrate that they fluently speak or read and understand English.
Yeah, that's correct.
Perfect. So for the person who was asking about the IELTS score, general university requirements would be a score of 7 or better if you already have that in hand. However, if you do not already have that completed, you do not have to complete the IELTS in order to apply for this program. Students, to be eligible for the scholarship, also have to have a college or university degree with a strong record of successful academic performance. As Joanna was talking about, have some evidence of some training in statistics or quantitative background. And as she mentioned, if you are a strong applicant, please, and that is one area that you have concern in, please don't hesitate to put forward an application so the admissions committee can fairly review and give you feedback. You also have to have some background, some verifiable interest or background in the tobacco control and planning to work in the area of tobacco control and be able to discuss that in a statement of purpose. And that is all of the requirements for that certificate. So again, these are great questions. Love to hear that you're interested in the program and want to make sure that you can proceed given all the information about the tuition. So if other questions do come up in this area, as you can see, my phone number as well as my direct email are listed on here. So you can feel free to go ahead and reach out to me directly and let me know any specific questions that you have as they pertain to your background. I think there is a question, and I know that we don't have an integrative activity for this program, but they want to know if there's any capstone project or meeting work that has to be done at the end of this certificate.
No, there is not for this certificate program. There is for the other master's degrees that the Bloomberg School is offering, but not for certificate programs.
Perfect. There is just more of a general question. I think this is just more advice. If there's any master's degrees or PhD programs that students who have an interest in this area can look to move on to after this certificate.
Oh, so for other training?
Correct. For additional education, if there's any suggestion on master's degrees or PhDs that they can look into that would allow them to continue their work in this area and continue developing in an academic capacity.
All right. Well, I mean, again, there would be jobs available to you with the certificate program, but there are a range of full master's degrees that you could consider as the next step. It could be a master's of public health, could be a master's of health science, a master's of science in public health. There are a range of degrees, and because tobacco control is such a multidisciplinary field and really requires expertise from a range of disciplines, you don't necessarily have to have a particular degree to, to make sure that a door is open for you. You can have degrees in the social sciences, in public health, and the hard sciences. So there's really a range. And then there are, of course, doctoral programs if you want to pursue an academic route. And again, there would be many disciplines that would be able to make important contributions to the area of tobacco control.
Perfect. Thank you so much for that. I think that we have come to an end of the more generalized questions. I see a few students, a few candidates that still have more personalized questions as far as their backgrounds are concerned. I look forward to speaking with you directly and sharing some more details and talking with you about your background. But at this time, Joanna, do you have any closing words for our audience?
Just to say that the folks at Wiley are really knowledgeable about this and the other programs, so really encourage you, if you do have any questions, to please reach out to them, and they'll be able to help give you the information that you're looking for.
Thank you so much for that. I also want to reiterate that we will be sending a recording of this presentation out. So if you were listening to Joanna speak about anything on the industry or the courses that you want to go back and listen to, you will be having a recording of this sent directly to you. We look forward to personally working with you. And at this point, applications are open and ongoing for the fall of 2019. If what you heard tonight really excites you about the tobacco control industry and really looking to move your career forward, you can see there are 2 codes on here. You can go ahead and take a snapshot if you're ready to start an application, or if you just want to learn more and kind of go back to our website to gain a little bit more insight. But reach out to us. Let us help you through the application process. And thank you for your time this evening. Joanna, thank you so much for all the details on the program and taking the time to present with us this evening.
My pleasure.
Thank you, and everybody have a wonderful night.